Namaskar and welcome to Apollo 24/7's Health Hour. In the new year, we wish you a very, very happy and a healthy year ahead. This is 2024 and देखते देखते हमने एक बड़ा सा पैंडेमिक पार करके काफी सारा सीख के आ गए हैं. But we still want to achieve our goals. 2024 brings us a lot of positive vibrations, and we want you all to hack the 2024 fitness goals with us. Apollo 24/7 is always there. आपका health का कोई भी मामला हो, we are there to support you. Please download the app so that you can book your consults with the experts, also buy medical whatever prescriptions that you have, and also book your lab tests. So on this show, you can ask your questions. We are bringing you an expert to this show where you can talk to the expert and get an answer, solution for your query or question. You must be watching this on a YouTube, social media like Instagram or Facebook. But if you want your query to be answered, just hop on to the YouTube channel of Apollo 24/7 and please leave your question or query in the chat box from where we shall take up your question. So today we are going to talk about something very, very interesting. How to hack your 2024 fitness goals. And today's expert is going to join us now, Dr. Amitava, who is a general physician from Apollo Multispeciality Hospitals, Kolkata, with more than 20 years plus experience. He specializes in the treatment of hypertension, diabetes, raised uric acid, dyslipidemia, and he's published papers and Keepers of Flame COVID Warrior Award भी मिल चुका है सर को. And he is an IMA, Indian Medical Association, and Medical Council of India member as well. Let's welcome Dr. Amitava. Good morning, sir.
Good morning and Happy New Year to everybody and you, ma'am.
Thank you, sir. Thank you so much. So वैसे happy and healthy भी बोल सकते हैं. Let's all be very positive and healthy here.
Happy and healthy New Year to everyone. And
Thank you.
to all my viewers and my colleagues and my friends and my brothers and sisters, wish you all a happy and healthy New Year. Okay,
Let me start by asking. Yes, sir. Thank you. Let me start off this discussion by asking. अगर मैं fitness के बारे में बोलती हूँ, तो being healthy we all understand. Being fit, what does it mean to be fit?
Yeah. What does it mean? As you said, what is health? As we know, health is not only a physical and mental well-being. It is not merely an absence of disease or infirmity. By positive health, we mean a complete well-being of physical and mental health, and not merely an absence of disease or infirmity. Human being, everyone
Correct.
is different from each other in so many ways, at the physical level, mental level, emotional level, spiritual level. Good health is one of the priorities of our life because it is our duty towards ourselves. This is only with good health we are doing only favor to ourselves. We are not doing any favor to anybody. If we are fit
Perfect.
and healthy, if we are fit and healthy, we can avoid miseries of pain and sickness which are yet to come and which has not yet arrived. We can avoid these things.
Very well said.
So what we are today I'm trying to say is that we can follow a few tips that could be helpful to us. So when it is New Year, which is easily can be done by everybody, one of us, is that once in a month we could observe a fruit day to give rest to the digestive system and improve our metabolism. Non-processed food should be done once in a month throughout the day. We will not take any oil and any processed foods throughout the day for once in a month. Only vegetables and fruits.
I shall
Second is
write down these points so that we can reiterate all of them. We can revisit all these points in detail, sir. आपने फर्स्ट बोला है कि एक फ्रूट डे होना चाहिए एंड सेकंड पॉइंट आपने बताया कि नो प्रोसेस्ड फूड्स
no processed foods in that day on the fruit
on
day.
that day. On
On
the fruit
that
day.
day.
Okay.
On that fruit day.
Okay,
No
doctor.
processed. And second is that since we all know our body is composed of 60% of water. So we should have plenty of oral fluids. We are
Yes.
basically live in the tropical countries where we most of the time we are having a climate which is over 30 degree. So
Correct.
uh, water loss, fluid loss from our body system is a very common. So what I would suggest is that have plenty of oral fluids throughout the day, and in the morning, try to drink a glass of lukewarm water with a slice of salt and a slice of lemon added to it. What it does
Okay.
is that these are the natural occurring antioxidants that will remove the free radicals from your system and try to detoxify your system.
Okay. So lukewarm water, hydration important है. Lukewarm water के साथ शुरू कीजिए with नींबू पानी, with नींबू and pinch of salt.
Pinch of salt for the
Is
electrolytes or whatever. Yeah, that will
right.
detoxify your system as well. Try to drink it twice a day. That will be very good. Throughout the day, whatever the free radicals that may have occurred in our body, that can also be minimized.
Wonderful. So while you're giving me the next tip, sir, I welcome the audience who have already typed their questions. Mahapatra ji, Aniket, and Arpita. I'm going to take your questions very soon. Please keep them coming. And let's continue with the list of good things that we can note down for the year.
Yeah. Third thing is that be active in a simple way. We don't, if
Active.
you don't have to go to the gym and everything, we just what we want to do with your hands stretched, try home yogashanas, forward and backward bending, side bending. We can do back, both side twisting. We can slide back just to this will strengthen our spine muscles. What is that that many of us in with advanced age suffer from osteoporosis and with all these skeletal low back pains. This we can minimize it. What is that? Right? There is a famous Gleason formula of DVF. What I'm trying to say is this D stands for dissatisfaction, V stands for vision, and F stands for the steps we need to do, and R is what we is the resistance. This DVF has to be greater than R. Say what example tell you dissatisfaction is that I am having a fat body. This is dissatisfaction.
Right.
Vision stands for I want to have a six packs. Yeah, I want to reduce my weight by 5 kg. This is my
Yeah.
vision. And steps is that work out 6 days a week. I want to remove my I want to change my dietary habits, as we said, fruit days, low calorie diets, whatever. These are the steps. And resistance is the most important thing. We have to overcome this. Say, I don't have time. I don't have a proper guide. I don't have proper space. I don't have a proper climate. These are the resistance factors. I'm not feeling tired today. Motivation is easier to get. Motivation you can we try for short time सक्सेस कि हमको 5 kg वेट कम करना है. चलो कल से वर्कआउट शुरू कर दिया. एक हफ्ते में 500 ग्राम वेट नहीं कम हुआ, we are stopping the exercises. But we have to, what I'm trying to say is that motivation has to be converted into a daily routine, and daily routine has to be converted to a discipline. Then only we can
Wonderful.
succeed. Then only we can
So
succeed. Yeah, yeah,
consistently you have to.
you have to
Wonderful,
do it
doctor.
consistently.
DVSR लिख लीजिए मेरे दोस्तों, बहुत ही अच्छा पॉइंट बोला है डॉक्टर अमिताभ रे ने. तो एंड being active is our third point there.
Yeah, yeah, and you have to over. Most important is that to overcoming the resistance. What we say is DVS you can easily acquire. Yeah, I want to have this. These are the steps for it, but you have to overcome the resistance. Okay, resistance overcome नहीं किया, you're not. So this, as we all know, there is a few jokes that every January the gym population increases, and by February it reduces. The January gym joining fees is very high. From February discount period starts. This is a consistent joke
Wonderful.
throughout the country. But the thing is that this is why it's happening because we lose motivation. We don't convert it into the discipline. हमको short times goals
Correct.
चाहिए. But we have to think it
जी.
in a long term. We have to think of it just like in a success. We have to go through class one, two, three. Then you can go for higher studies. Then you can go for the career motors. Na? Without studying in class one, you can never reach where you are, ma'am, today or where we are all today. Whoever personnel
Right.
is doing whatever work. It's a time period that grows up. And
Right, sir.
third
So
is
one
that
first one is fruit a day, a fruit day every month with no processed foods there. And the second one is hydration. Third one is being active, simple active exercises.
fourth is the mental relaxation. Whenever you are
Ji.
getting hyper excited, you need to control yourself. The best way is to, wherever you are in place, whether you are in a traveling situation, whether you are in a working place, just relax your shoulders, close your eyes, take a deep breath inwards and count for 3. Then exhale, count for 3, and repeat this process for 4 times. Try to avoid the emotional stress whenever, whatever work we are trying to do. This will pacify our system. And
Okay.
second is, once in a day for 10 minutes, preferably in an open sky, we should sit relaxedly with our shoulders relaxed in the straight spine. And we will gradually only just observe our breathing, how the breathing is going. What happens is that when you try to observe the breathing, you will be slowly realizing that it is becoming slower and slower, and it's becoming normal and normal. So your breathing pattern is getting slower. And when after 10 minutes you are getting out, these are not meditations. Just I'm saying that simple tips that can be done by all individuals. These are no health
Ji.
workers required, no guidance required. This we can do. Whenever you're coming, you can feel the mental calmness is there.
Yes,
And
doctor.
second is,
Wonderful. Any more
yeah.
in the list, doctor?
Now, and for the mental well-being, I'm saying, just for the say, some people will say that we are lacking motivation. Nobody is expecting anything from me. Even with the watching, say, for female individuals, just whatever work you do, just try to make the family members happy. Just try a new recipe. Just give some time for home decoration. Just try to decorate your bedroom, your living room, whatever you. The first impression when you comes into your home, you should feel relaxing. Yeah, I'm at my home. This is my place. This is my reign. This is, I am the king here or the queen here. So that sense of well-being is very important. And last and not
Absolutely.
the least is absolutely having a good sleep. Having
Sleep.
a good sleep, yes. Having a good sleep. For having a good sleep, it's better always to have a good sleeping discipline. Good sleeping
Wonderful.
discipline is that we should have a fixed sleep time. Fixed sleep time is that whatever, say it's 9 o'clock, say maybe 11 o'clock, whatever time it is. The time is up, you go to bed. No
Ji.
screen on time, no screen time 1 hour prior to go to bed. You
Wonderful,
may
doctor.
no, you may be
Because this is
having,
something that we all religiously should, must follow in the era of digital gadgets.
yeah, no screen time. Unfortunately, we also do it sometimes, but I honestly also try to avoid the screen time. uh, but always it's not successful, but try to maintain that. And to bring a good sleep, maybe you should, with all the Spotify, maybe the YouTube, we should have a sleep playlist. The songs
Correct.
that you love, the songs, or the music or the sounds you would love to hear, before that should trigger your good sleep together. And at the end of the day, try to find out what makes you most satisfied. Try to get out of the negative things, forgives everybody who have done things wrong to you today. You will be feeling mentally satisfied. And whatever things you have done wrongs today throughout the day, we all do something things which we should have, could have been avoided or should have not done, even by something to the colleagues or something to everybody. Just mentally say sorry to them, just say sorry to them before going to sleep, and think about the good things, about the success of your life, think about the positive things of your life you have done today, and you go to sleep. You will be
So
and
here,
already dream about the best things that could have happened in your life. You dream about the wonderful moments that have happened in your life, and you will be feeling better before going to sleep. And this
yes.
sleep preparation list, or somebody may try the sleep mask to make it more darkened. This will ensure a good sleep, make a good sleep prepared, but good sleep is essential for good health. We all,
हाँ,
basically, we always
तो मेरा
underestimate that.
हमेशा क्वेश्चन रहता है सर कि ये
Yeah, yeah,
स्लीप हम इतना इम्पोर्टेंट मानते हैं और सर्कैडियन रिदम को वापस लाने के लिए हम बहुत कोशिश करते हैं. देयर आर पीपल हु आर वर्किंग इन द नाइट्स, दे आर डूइंग नाइट शिफ्ट्स. इनका स्लीप पैटर्न ऑलरेडी बदल चुका है. So there are also children who there are students who are working in the night and working studying in the day. So how about these people? How do they catch up?
Yeah, Joe, night shift, the people who are working in the night shifts, that is what I'm saying. Just sleep rhythm, it's not basically about the sleeping in the 9 p.m. Then they should have a definite sleep pattern, sleep discipline. Say when you're coming back, sleep from 10 a.m. to 4 p.m.
So sleep discipline gets important.
Yeah, what I'm trying to say is that is where the sleep mask, the sleep playlist, the thinkings comes into place. It's not the sleep time. I'm stressing about the sleep discipline because say we have also the on-call days. We have also the days which we are when we worked in the government sectors. We were on days which we were on the emergency duties. The people who are working as the emergency doctors in the emergency department. So there will be the police personals. We all help. We have all these personals helping us throughout the 24/7 hours a day. So
Hmm.
these personals, we unfortunately don't think much about them, but the sleep for these personals as well. The thing is that the sleep discipline is the most important.
Right,
Sleep
doctor.
discipline.
So, so yes,
But
doctor. Quickly,
only
my
about 24 into
questions that
7.
absolutely sorry to disturb you. आपका
No,
please
no.
continue.
What I'm trying to say is 365 days, किसी का night duty, nobody has the night duty. It's only about a brief period. But if you maintain a sleep cycle, again you rebuild. Our body gets adjusted within 7 days. You also knowing me better than ma'am. You have much more shifting duties, shifts
Right,
working than but
right.
as you know, your body gets adjusted in days, 7 to 10 days. So when your sleep pattern again can be normalized, just like our taste
Right.
buds, it gets adjusted in 7 days.
Right, doctor. Thank you so much for those wonderful tips. So quickly, I'll start the questions from the audience before we talk about next topic. First thing that is Mahabhadra ji का question लेना चाहती हूँ. Good morning and happy new year, doctor. What are the tests that one get done before joining a gym? तो ये क्वेश्चन मुझे क्यों अच्छा लगा क्योंकि जिम ज्वाइन करना एक मैडनेस में या एक रेजोल्यूशन एक मोटिवेशन डे में कर लेते हैं बट दे वी डू कीप हियरिंग अबाउट स्टोरीज who have stopped gymming or which have worsened their existing conditions. So, who should get to gym? Who can lead a simple active life?
Yeah, the, the freehand exercises anybody can do. But as we all know, the whatever the resistance training and whatever the other exercises that aerobic
Right.
exercises and everything, this will increase the heart rates. There is some elevation of blood pressure. There will be some changes in the body system. The respiratory rate may be increasing. So these are all physiological changes. That is why we do in a stress meal test. So we try to
Right.
increase the heart rate to the maximum capacity. But for all our, like me, the middle-aged persons, they should have a cardiac checkup done, a basic TMT. So it is negative. Well, just should have a basic echocardiography done. So any doctor can do it so that your heart functions are normal. Then you can join the gym simply. Nothing
Okay.
needs to be. Regarding the asthmatic conditions, if you feel, I'm not saying regularly you should do a spirometry, but there are certain conditions like asthma that may precipitate during these exercises. But asthma people usually before 40 years, they usually have the symptoms and they know they have asthma, so they will be carrying their own inhalers and taking their own precautions. And they will be
Right.
knowing how the SpO2 levels are. So I'm not
Right.
worried about these persons, but the cardiac patients, the hypertensive patients, they should take special care. Regarding the blood cholesterol level or the blood sugar level, this did not need to be routinely done before doing a gym, but yeah, regularly periodic follow-up should be followed.
Yes. So there are two questions related to protein, doctor. One is Aniket Arkadi. Is whey protein good to complete my protein intake? Considering a lot of doctors do not recommend this. This is one question. And next is Vijay Lakshmi's question. Hello, ma'am. Both kids are very lean. They are very healthy and energetic all the day. What can I do to increase their protein intake? So these are two different age groups, sir. One young
Yeah.
person and one young kid.
What I would suggest is that first of all, there is a misconception that protein only increases the weight. It is the calories. Calories is the what we should do is that with healthy calories should be added regularly 300 to 500 extra calories per day. And for the children or for the people who want to add extra uh, 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 weight, they should eat smaller meals more often and have snacks in between meals. But
Yes.
what I'm saying that eat smaller meals but eat more meals. So that will give aid to digestion and that will add calories to your system. Add extra
Ji.
calories to your meals with your cheese, nuts, and seeds that can add the extra calories to your meals. And high calorie drink in between meals, such as milkshakes, can also be helpful in case of children. These are the some have a balanced diet, which such as with fruits and vegetables. But proteins, which I'm saying, is that they should come from the beans, pulses, fish, eggs, and the lean meat. All these things will be helpful. So we can, most importantly, is the exercises to strengthen and to build the muscles. This is the
Ji.
most important things. Other than adding only protein powders and protein shakes, because one thing we have to say, extra protein will put extra load on the renals, on the kidneys. Okay.
Right.
You can't give. That is why when we there is some protein restrictions when there is some renal problems. Okay. I don't want to go to the details and
I know, I
etc.
know. We don't want to scare people, but then you also have to be just because market में इतना सारा whey protein and protein shakes
No,
available है sir.
that is why I'm trying to say because of these
हाँ,
proteins and because of we are getting very young patients with the high normal creatinine levels
right.
because of these things. But these are all reversible, and that is what we take care of. But this can again, what as I've said, could have been avoided.
Right. So yeah, here we do see Gaurav who is 34. Gaurav says, I'm 34, too skinny, and I'm trying to gain weight. I'm taking enough protein and diets and supplements, but there's no change. I do work out every day. What else can I do?
Yeah, Gaurav, as I said, gain weight gradually by adding healthy calories. You should try adding around 300 to 500 extra calories a day. Eat smaller meals more often, adding healthy snacks between the meals. Okay.
Right.
Add extra calories to your milk with cheese, nuts, and seeds. Avoid the butters and the saturated fats.
Right.
Have high calorie drinks in between meals, such as milkshakes and everything. You can have this, badam shakes, or whatever the things is there. In the warms, is you can add lassis as well.
Yeah.
Have a balanced diet. Choose from variety of fruit groups such as fruit and vegetables. Starchy carbohydrates will be helpful, and the dairy and alternatives. Proteins in your meal should be like beans, pulses, fish, egg, and lean meat. Lean meat is something which is skin is peeled off. Meat with peeled off skin, it is healthy. That is without devoid of cholesterol, and you can healthily take it. And build your muscle with strength training and yoga, resistance exercises. Plus, just all the film stars too. You can. What I'm trying to say is that on screen, the silver screen heroes, they don't do much tampering with their diet plans. They all
Correct.
go and
Diet.
build up in a harder way. They all
Uh-huh.
go to the gym rather than trying the short term, as I have already said. Avoid short term goals. They always
Correct.
do it in a period of 3 to 6 months or 1 year, whatever may be
Ji.
the age. They don't stress upon much of these protein diets or the protein powders or the protein bars, what I am
और
saying about.
सब हमने ये भी देखा है जो कंसिस्टेंटली जो सिल्वर स्क्रीन के हमारे हीरोज एंड स्टार्स हैं जो कंसिस्टेंट है उनका भी देखा है जो सडनली बल्क अप हुए हैं जिनका हेल्थ प्रॉब्लम्स हुआ है वो भी हमने सुना है there are big heroes who have gone into big troubles because they have increased unnecessary protein and they've done to beef up. So we did hear that certain stories as well. It's not that glorious
Yeah,
as well.
that is what I am saying. But the clever ones, they avoid things like that. They do it in a harder way. They build up their own muscle mass and then they appear on the silver screen. The clever ones, they don't take the shortest route. Okay.
Right.
So
So
this is what
yeah,
I say.
anyway, muscle mass के बारे में बात कर रहे हैं. So what's the importance of muscle mass? So Mahapatra ji पूछ रहे हैं, how do we increase muscle mass?
This has to be done by resistance training and the exercises in the gym, and you have to do it in a regular basis, in a physical basis. Let's say we were in class 6 or 7 when I saw Mr. Salman Khan in his first film. In his first film, in 6 or 7, I think, and Shah Rukh Khan, I think, was I was in 10 or 11. So then they were the first films I have seen them in the silver screens. And today, my sons and daughters are going to see their films when Jawan is released and Pathan is released, everything. So, what I'm trying to say is that they look at my body and look at their physics. I am much younger to them. That means what they are doing, I am not doing. And they are doing it successfully. There is no saturation point. There is consistency in their plans. They are trying at that whatever their motivational level. I already said that has to be high to keep such a motivational level. Say as Virat Kohli, he's performing from 10 years, and he's every innings he has to go there and try to score a century. That is what comes to body mass building and maintaining a good health as well. It has to be come from your inner motivation has to be there, and you should be disciplinized.
Absolutely. So,
They are very highly successful
muscle
because
mass
they are
discipline
highly
is the
disciplined.
yes, yes, doctor. So next question is Sheikh Shagufta. What can I do if I'm about fatty liver?
Yeah, fatty liver is basically a lifestyle disease. But it ranges from lifestyle modification to altering your. You have to reduce your body weight. You have to make your good sleep pattern, make good habits. Basically, the treatment of fatty liver is the reduction in body weight, and you have even if you have a bit of cholesterol, because there is some misconception that consumption of ghee or consumption of raw meat causes the consumption of red meat causes the fatty liver. Fatty liver is somewhat related to the blood lipid levels. So, if basic treatment of fatty liver, the medical treatment is a different thing that doctor is going to take care of. We do take care of it certain medicines that works well. But the basic thing is that fatty liver, there are 3 to 4 grades of fatty liver. Fatty liver grade 1 and grade 2 is reversible, but from grade 3 onwards, when the fat cells enters into the liver tissues in between the liver cells, then it becomes a bit difficult. And grade 4 is then when the complications of the fatty liver, starting from cirrhosis, may occur. So grade 1 and grade 2 is a common finding which we find in most of the cases, and these are all reversible with simple lifestyle modifications. And as we know that if there is a certain 5 to 7, 7 to 8, 10% in reduction in the body weight, the whole fatty liver may vanish as well.
Wow. So good. So Pele, we all need to have weight loss is not for appearance. Weight loss is for our internal organs and their functioning better. So we all need to understand optimal weight
I'm a
so
bit
that
obese. I'm not saying about simple things about your member. So I'm a bit obese. I'm having a fatty liver. For me, the best treatment is to reduce the body weight,
correct.
whatever the thing is that. But for other peoples who are having a bit of bad cholesterol, a bit of metabolic disorder like diabetes and other metabolic disorders, they need to control those factors as well. This is what I said is a multifactorial. But basically, whatever disease you may be having, starting from diabetes and everything, basic thing is that you try to reduce the body weight. The whole thing is then manageable. Your sugar level comes down, your body oxygen demand comes down, your lipid profile normalizes, your fatty liver reduces. These are all the things that you can definitely get benefit from.
Great. So, Doctor, here's the next question about Mr. Chandran, who is 68-year-old male. So, why do we lose motivation as we age?
Yeah, as we were all discussing, so the motivation as we age, I already discussed about 2 or 3 senior silver screen heroes. How do they keep their motivation? That is the thing is that what I was saying about the Glacian formula, the resistance that we don't like have facilities, we don't have a strict instructor. But these are the simple things, sir. What we can do is that you can try more. You have to make it a habit yeah, I will be making a 30 minutes time for myself. I will be doing with my arm stretch the simple stretching exercises and the simple twisting exercises that can be done at home. And there are a lot of guidance nowadays, which the channel we are doing in the YouTubes and everything. I'm not saying, sir, you try hard ones, which where definitely a gym instructor is required. But sir, you can try the simple yogashanas at home, and you can try the simple forward stretching, backward stretching, the side stretchings, and the twistings. You can do these simple things at home, but you have to make yourself disciplined, sir. Whatever may be the results, I will be doing this every day. As I told you, sir, there is no short-term goals. We all have to. We all have to go through long-term goals. I'm taking this in myself also, sir. The blame.
Absolutely, sir. So let's not worry about how much we are doing, but we should concentrate more about how many days are we doing in a week,
Yeah.
how consistent we are in a week. So it's all about
If
habit
we
and
are
habit.
consistent, results will definitely come. That I'm sure.
Yes, doctor. So here's Lakshmi, Santa Lakshmi, 52-year-old female. What causes sudden cravings and that leads to excess eating?
Yeah, diabetes may be one of the causes that really increases your hunger. But the other thing is that at some emotional points, there may be you may be feeling, yeah, I've got no works to do. There may be some depression is also one of the signs of overeating and everything, because you feel like you have nothing to do. But whenever you feel hungry, my suggestion is that we also try to do. I'm not saying that we also do. Have fruits, have healthy snacks. You can have nuts, seasonal beans maybe there, have salads. Try to have sprouts. Try to have it in that way, because you may feel hungry. There is no, your metabolism may be a bit higher than or normal. There is no problem with that, but you can have manage it with a lot of smart thinking, ma'am. You can try with anything with like the salads, vegetables, fruits, sprouts, anything. Even you may try dahi as well. Dahi is also good if you don't add extra sugar to it.
Right. So, doctor, I understand that craving is not just one person's problem, and craving should not be seen as a major problem. How do we understand craving is the solution for it? For example, as an individual, I crave for certain foods as a female. Just my PMS adds to certain cravings. There are times if I'm not sleeping on time, then I have a craving. There are other conditions as well that are attributing a craving routine in my body. So I need to understand what leads to craving.
Yeah. So first of all, I told you that they're the taste buds which there, and that's what you also said, that when I'm not sleeping, these are certain some of the emotional factors, our likings, dislikings. These are all contributing to the table. This is more at the emotional level. I said when it's about the disease level, then it's a different question altogether. But at the
Right.
emotional level, if you say if you are going to sleep early, if you are maintaining a good sleep, then you can avoid this cravings of opening the fridge and having chocolates. But the thing is that you can, when these happens only if we don't sleep in time. But say I am having a craving for chocolates. Whenever you can, just as we could try to quit smoking or something else, whenever you're having craving for chocolates, see when you're having salads and when you're having, say, an apple as a fruit, or you're having a banana, whenever you're making these habit changes, see within 7 days or our taste bud changes. You will be getting accustomed to the cravings.
Right,
You will
right.
be
So give
getting
it time.
accustomed to the craving. Yeah, give it some time. Give it a 7 days time. Make it a thing where don't bother yourself. Don't disturb yourself. Let the cravings
Right.
come. Whenever the cravings come, just substitute with the healthy food. You can
Okay.
have
Okay.
some dry nuts as well, whatever resins, whatever you can have it. Say you are having craving for sweets. Somebody like having craving for sweets. Is it
I
khejur?
have. Let
Yeah,
me.
but you can have it from the dry fruits, khejur or something like that. So you can have it from them. You can have it from them. So these will add natural fibers to your diet. That will carve your sweet tooth as well. So I think that these are some minor changes that would be. But once in a day, say you are having a low diet, you are having a day. Once in a day or once in a while, you can have this sweets. There's no problem with that. You can
जी
have
जी
anything that is taken in moderate amount. Say you are having one sweet per day. If you are consuming anything in moderate amount, everything can be taken. Even if you
वंडरफुल
are
एडवाइस
having, if, but the thing is that in moderation, excess में सब कुछ ही बर्बाद हो जाता है. When you take in
वंडरफुल
moderation, everything
तो
is good. No,
संस्कृत
all
में
foods
बोला
are
जाता
healthy.
संस्कृत में बोला जाता है नॉट जस्ट फूड सर अति सर्वत्र वर्ज्यते.
हाँ,
So, not just food, but in everything, excess is a killer. So,
yeah,
let's
yeah.
understand that in moderation. Wonderful, doctor. Great advice there. So, next question is about Prasanna's question. How can I manage stress and anxiety? Do they worsen my diabetes symptoms and it does impact my fitness goals?
Yeah, as I said to you, whenever there is some problem regarding you're getting anxious, so you're getting some angry with somebody. Just I said, pause yourself up. Stop, take a deep breath, count three, exhale, count three. Repeat the cycle for 5 times. Say you are in a street rage. Say you are having a sudden burst of anger with somebody. You can say you want to say something, you want to answer somebody in the mouth, in the face. Then you can control yourself. And as I said, just try a 10 minutes. If you're a person who can meditate, you can consult with your spiritual gurus and everything, or you can go for the motivational therapies and everything. But if you are a normal person, you don't want to go anywhere, just go to the rooftop or somewhere in the open sky where there is peace, where there is less sound. Just close your eyes, erect your spine, relax your shoulders, count your own breath. Nothing
Yes,
needs to be.
doctor.
Observe your breathing. Observe your breathing, and when you can observe your breathing for 10 minutes, you will be seeing that your breathing becoming slower and slower and more in a normal pattern. This will help
Yes.
you calm yourself. And at the end of the day, just try to just make a routine of making a list. What are the do's? What are the misdeeds, or what are the minuses in my life today, and why is that happen, and what are the positives of my life today, and why is that happen.
Yes.
Reduce the minus points from the next day list, from the next day's motto, and go with the positive attitude, and persist with the positive things and the positive attitudes which you have done today with the next day. These are the simple steps that will help you to rectify yourself and pacify yourself and give you mental peace. But
Wonderful.
if you have a medical disease, consult a psychiatrist.
Okay, doctor. Dr. Ray, here's a question about intermittent fasting. Two people are asking about it. Mohammed Javed ji पूछता है, will intermittent fasting lead to gas trouble or heart burning issues? How to avoid these during intermittent fasting and what must be the ideal time?
No, this is intermittent fasting is great if you can follow it. But the thing is that with the office hours may come in between, your working hours may interfere with these routines, but there is a lot of gastritis issues may come into this place. That is what I said. If you can practice this thing, all the things which are there is great, but all has its pros and cons. Say if you
Correct.
are having, well, that is what I suggested, to have a fruit day or have a carbohydrate free day, because whenever there is, if you have a gastritis problem, you need some medicines to cure it. It's not going to go away self by self. And if you consume something, then your intermittent fasting again is a questionable to the person who has advised you the intermittent fasting. And you also want
Correct.
to feel confident, yeah, I have broken it. So, if you can't persist with the plan, you have to change the plan. But intermittent fasting, no doubt, is one of the best proven plans to reduce the body weight and improve metabolism. But it's a strict plan, but one can, if one can stick to it, it's a great.
Right. So Aniket is asking a continual question to intermittent fasting. How good is this for your body? How can we protect muscle loss, which will happen along with the fasting?
Now, usually the muscle loss doesn't have with the fasting because you are replacing it with the meals in the daily way. You're fasting only for about 12 hours to 15 hours with this intermittent fasting. And always with the intermittent fasting regimen, there is no restriction of fluids. Fluids can be taken, but non-caloric fluids is usually advised, but fluids are always advised. But the thing is that there will not be muscle loss because you at the end of the day replenishing with whatever food you are taking, and your regular protein allowance is 50 gram per day that you can with any piece of fish or two piece of chicken that would be good enough for you.
So, anyway, we're talking about protein. So, NV is asking this question. I'm having acne while I'm consuming protein shakes. Any alternatives or anything that I can consume to redo the effect?
No, the thing is that if you are having problems with the protein shakes, huh? So for acne, you definitely take the help of a. I don't the dermatologist. There are lots of treatments for acne. You should go with that. But you can consult some physicians. But we have to check whether you have any metabolic disorder problems because acne is also somewhat related to the metabolism of your own body. If you are having certain problem with certain preparations, you can always substitute this with the diets. You can always substitute the proteins with your lean meat. You can have a high protein diet. You can have the chicken soups. You can have a chicken whatever the chicken with the minimum amount of oil with the preparations is about. Anything you can replace with that with the proteins. You need not need to just say I usually personally don't advise much of a protein powder to anybody. I usually say that you can have 2 eggs per day or whatever the high protein diets you can have, consume chicken legs, whatever the chicken pieces you can have. And even if you consume mutton, I said I don't have any problem with the red meats. If it is a lean meat, skin is peeled off, and if it is taken in moderate amount, then everything is okay with us, fine with us.
यस डॉक्टर, थैंक यू सो मच। अर्पिता चैटर्जी, इनका क्वेश्चन है लीवर के बारे में। एस जी पी टी इज 288, एस जी ओ टी इज 208। आई एम टेकिंग यूडिलिव 302 टाइम्स। एनी हेल्प बिकॉज आई वॉन्ट टू गेट दिस डाउन टू a proper diet? Please suggest me a diet so that I want to bring this value to 122.
Yeah, it's too high a liver function, but we have to see all the why is it raised. I'm not sure about, but you have already given me the values because these values, whatever say we have already discussed, is about the fatty liver, but the fatty liver we have discussed is about the non-alcoholic fatty liver disease, which is related to obesity and the fat gain. But there is alcoholic fatty liver disease. There is some types of hepatitis which causes the transaminitis. In fact, in cases of some viral fevers also, there is some transaminitis where the liver enzymes are raised. So, without knowing the cause, I can't comment about it. But ursodeoxycholic acid, yes, is a good drug. You can continue with that. But I personally feel that you should, if it is a non-alcoholic fatty liver disease, then you should go for the weight reduction and the other drugs, whatever celebrities or whatever is available. You can try with that. But
जी।
if it is other causes are
Oh,
there, then we need to
uh,
see a
sir,
physician.
one more detail to add, sir. She's 34-week pregnant.
Yeah, that is why I've said that 34 weeks pregnancy will not cause the liver enzymes to go high. This is something I said that there may be some hepatitis, some types of hepatitis, or some types of liver inflammation is there that is causing it. It's better to just consult a doctor regarding why it is happening because
Okay.
without
One.
seeing this physically,
Yes.
you can't
Arpita
comment.
ji, you must be seeing a specialist already. Please continue visiting there. Or Apollo 24/7 is always there with multi disciplinary experts with on the panel. Please do consult them. And Dr. Amitav Ray का भी हमने link डाल दिया है. You can consult him as well. Thank you so much for the advice, Doctor. Dr. Ray, here's the next question. Can we, this is by Samya Mishra, how to reverse autoimmune diseases and also how can I regulate TSH in thyroid? Sir, we are talking about pre-existing diseases anyway. So thyroid and how does it affect our metabolism and fitness?
Yeah, so thyroid disease, what we need to say, if it is a, basically we are talking about two types of thyroid diseases, we can simply say. One is hypothyroidism, where the thyroid function is suboptimal. Here, the treatment is very simple. Thyroid hormone is not being produced, so you have to replace it naturally with the natural thyroid hormones from exogenous sources. Usually, we use advise the tablets. Yeah, thyroid has some got problem. Thyroid has some got rules, as we all know, starting from the emotional level. If there is hypothyroidism, we feel mentally down. As soon as it is corrected, you feel mentally elevated to cholesterol metabolism, and a lot of varieties of the roles of thyroid hormone are there. But that all gets corrected once you consume this type of medicine. But if there is in fact, hypothyroidism will be related to obesity, it may be related to constipation and everything else. But in case of hyperthyroidism, the thing is that more thyroid hormones have been produced. This is a much a critical issue. Why thyroid hormones are being produced more? Then this hypothyroidism, to me at least, is a simpler one, where we can just simply replace it with hormones. But hyperthyroidism, this is a where there is a thyroid nodule or etc. We all know then this become we have to investigate immediately why this is happening. For hypothyroidism, no extra test is required rather than the thyroid hormone itself. But for hyperthyroidism, there needs to be a proper workout with TC scan and everything, to why it is happening.
Right, right, doctor. Thank you so much for that in detail explanation. Next question is Mr. Vijay, 41-year-old male. Do please suggest some lifestyle changes, which is a general one, but he wants to make his immunity better in 2024. I get ill very frequently, especially with cold and cough. So how can I improve my immunity?
Yeah, basically whatever it is saying is that cold and cough, basically these are all viral origins. Viral origins, immunity is natural immunity, whichever your body is offering. You can boost it. That's what we have said, that we can boost it with the simple remedial healthy measures with regular yogasanas and the regular whatever healthy food I'm taking with the weight reduction. This will optimize your immunity level. As we have said, you can consume some lukewarm water with lemon slice. With that will add vitamin C to your system as well. The antioxidants will remove the free radicals. But see, at the end of the day, you will have to protect yourself. You to prevent the recurrent viral infection, you will have to when going into the public places, you will have to use the N95 masks and everything. And second is that to take care, you will have to have, whenever there is some these are also allergic as well, so you will have to take regularly anti-allergics, or you will have to consult a physician when there is a viral. You have to avoid those viral outbreaks. You have to avoid these things. There are lots of multiple measures that needs to be done within the recurrent cough and cold. If it is an allergic one, you need to consult us, or you need to consult an allergic and immunologist specialist. But basically, these are all chronic treatments. It will happen again and again. There are some vaccinations, influenza and pneumonia vaccinations, which we do. You can also enroll for those programs, but then you have to physically come and visit one of us.
Yes, doctor. Thank you so much. Because immunity is something that I don't. We are all born with it. बट कोविड के टाइम में हमने इम्यूनिटी के बारे में इतना सोचा है, इतना बात किया है, बट शायद
This
इतने
is
कुछ
a,
है.
yeah, this is a natural. You rightly said, ma'am. This is a naturally occurring thing. But only thing is that, say, with my physical level, the immunity deficit due to the obesity and due to the free radicals, these are the things that may contribute to my reduced immunity. But a reduced immunity doesn't mean that you will have the disease. It's only
Right.
not about the immunity that the disease is prevented. Our body has some memory cells. So once the infection is there, the body recognizes that this memory cell recognizes that this is something which is harmful to me. And then the body itself manifests its own defense mechanism so that this thing doesn't cause the harm second time.
Right.
This self mechanism, when it works against you, then there is, as in case of recurrent dengue infection, the secondary infection, that is why we say important. In case of COVID, as you said, this immunity system was working against you and was killing the uh, good pulmonary cells. That is where the problem was came. It had a bizarre immunity response. Then,
Okay.
when the immunity response is bizarre, then it becomes very difficult for general people or the clinicians to treat because you are dealing something which is not you are not accustomed to. In fact, we
Correct.
required the mortality and morbidity when the COVID initially came. We were all in a state of confusion कि ये drugs कम करेगा वो कम नहीं करेगा. Whenever we settle down, you know, we know that the remdesivir will work after within this time period, and people also at the first stage people were afraid that I will be socially isolated if I am tested positive. People didn't go for the test, but later when people came to awareness increased, somebody who had a sore throat even had a running nose, they were also going for the tests. So with awareness, things came gradually became better, and we conquered COVID. But it didn't happen one
Right.
day. Not only because of the doctors, it was because of the common people, because of you people who were all motivated and who all wanted the change, and that is why the change occurred.
ओके, तो किशोर जी का क्वेश्चन भी समथिंग सिमिलर था, कोल्ड क्यों होता है समर एंड विंटर में? आफ्टर टेकिंग ऑल द प्रिकॉशंस आल्सो आई डोंट अंडरस्टैंड, आई एम लिविंग इन अ हेल्दी एनवायरनमेंट.
No, the summer COVID is not there. It's there. It's there. It is there to stay. But the thing is that, as we all know, there is a new variant of COVID is right now as also in the environment. But if we can follow, maybe I am also infected, and I also have been infected. Maybe someone else have been infected. But if we follow the simple rules that we used to follow, wear the mask in the public places, maintain social distance, maintain personal hygiene, maintain the hand sanitization, then these simple remedies will again help us to overcome these COVID periods as well. Nothing to
Right.
worry about. Basically, viral infections, these viruses continuously changes their character. The vaccinations and the strains which we are working today, will change after 15 days. This is the characteristic of the viral change. But there is one good thing about the virus: the more is the infectivity rate, the less is the mortality and the severity rate. The less is the mortality rate. So don't worry
Wonderful.
about these things. Don't worry about these things. Live a life and just maintain the social hygiene.
Right. Yeah. So while we were talking, a lot of people were asking, Mr. Subhash, Arpita, and Kishore. Everybody's asking about a nice plan or a diet plan or a lifestyle plan to take care of their. So with that, we would want to wind up today's session. So over to you, doctor, for top tips with good plan for us.
Yeah, top tips is that first of all, I discussed, is that first of all and first foremost is that once in a month observe a fruit day to give rest to the digestive system. Second is have plenty of oral fluids since our body is composed of 60% water. Twice in a day, drink a glass of lukewarm water with a pinch of salt and lemon. This will add vitamin C. The naturally occurring antioxidant will remove the free radicals from this and detoxify our system naturally. Be active, strengthen our muscular and skeletal system. We can practice yogasanas, forward and backward bending, side bending. We can practice right and left side twisting with our stretched hands. This will strengthen our spine muscles and improve our posture. Make exercise our first priority. Try to follow Glichen's formula where DVF is greater than R, and reduce the resistance for exercise. That is what we don't have time. I don't have facilities. I don't have a proper guide. No opportunities, etc. Calm your mind. Breathe twice a day with sit or stand with relaxed shoulders, and then inhale deeply and count three. Then exhale slowly and count three. Practice this 4 to 5 rounds of this breathing system. It has the power to dramatically improve your emotional states and induce calmness. Take a 10 minutes time for yourself. Sit comfortably in a quiet place, preferably under an open sky. Close your eyes, make your spine straight, relax your shoulders passively, observe your breathing. You will be gradually see that your mind and breathing relaxes. Give 10 minutes a day to your self creation, like potting plants, decorating houses, try new food recipes, have a proper sleep, have high quality sleep, maintain a good sleep routine for going to bed in time and getting out of bed in time. No on screen activity for 1 hour before sleep. Can make a sleep preparation playlist on your YouTube or your Spotify. Wear a sleep mask and have breakfast with lots of salads and vegetables. Follow it with sprouts. You can have dahi as well. And if possible, make your lunch with whole like khichdi types with where you can add with the rice a lot of vegetables, a lot of seasonal vegetables, a lot of pulses. Have a diet which is higher in fruits and vegetables with lean meat. You can have some with try to replace refined carbohydrate with complex carbohydrate. And following the simple health tips, we I think we can maintain a healthy life in 2024. Thank you.
Wonderful, sir. Wonderful, sir. Thank you so much. I have made a list of the points. I think we should put all of the points in the chat box as well so that our viewers can get it later as well. Thank you, Dr. Amitava, for this time on Sunday morning. And may you have a happy and a healthy new year ahead, sir.
Thank you, ma'am. Same to you. And same to all the viewers.
Thank you. Namaskar. So that's it for today, folks. And here is your time to answer my questions. I'm here with a health quiz. I'm going to ask you three questions. If you want to participate in the health quiz, please hop onto the YouTube chat box, not on this Instagram or Facebook, but please hop onto the YouTube chat box and type your answers there in the text box. And winner's name will be announced towards the end of the show. If you are selected as the winner, then you have to write back to us with all your contact details by Wednesday. We remind you by Wednesday of every week to marketing at apollo247.com. Gift vouchers will be shared with you and winners will be selected at the sole discretion of Apollo 24/7 team. तो चलिए आज के तीन क्वेश्चंस हम डाल देते हैं आपकी स्क्रीन पर. Fill in the blanks. This is question number one. You just have to tell which word is that. Increased dash activity, that is P से शुरू होता है, blank Y blank ICAL. Increased dash activity has been linked to several health benefits. What is that? Question number two. True or false में answer कीजिए. Regular exercise guards against anxiety and other mental health issues. Please answer into true or false. Question number two, regular exercise guards against anxiety and other mental health issues. Is that true or false? Question number three, yes or no में type कीजिए. Rest days help you to repair the muscle damage from exercise. Yes or no? Rest days help your body repair muscle damage from exercise. These are the three questions for today. Please, I see a lot of people, the regulars also, and then new people also have joined us in answering questions. Thank you so much. Keep your answers coming in. And in the meanwhile, let me give you the health coupons. The health coupons for this week are Ask Doc 150. The code is ASKDOC 150. You can consult top doctors from Apollo hospitals and get 150 rupees cash back on online doctor consultation. The next one that we give you is First 3 FIRST3. You type this code when you buy medicines, order medicines direct from Apollo and get 25% off on online medicine orders. You can get up to 2-hour delivery as well when you order from Apollo 24/7. And health our viewers, you know that you can now use this code HH247 in addition to the other codes that we have given. Get 199 off on online consultation with Apollo doctors and up to 20% off on medicine orders as well. These are the coupon codes. तो ये यूज करने के लिए आपको पहले Apollo 24/7 ऐप डाउनलोड करना पड़ेगा. एंड अगर आप ऐप डाउनलोड करते हो पर क्विकली आपको मेडिसिन भी चाहिए तो व्हाट्सएप भी कर सकते हो. We are just a call away. You can call or text on 9355 247 247 on WhatsApp. You can avail all the healthcare services of Apollo 24/7 just by adding this number on your WhatsApp list, and they are right at your doorstep. So this is that wonderful session. Next session, बहुत ही important session. Dear friends who are watching, I think this is something that you all have to take care. General cough and cold or COVID. You know, this has been that topic. कितने सालों से हम लोग यही टॉपिक पे बात कर रहे हैं, but every season that we need to understand how do we differentiate and how do we protect ourselves. Let's talk about how to differentiate the general cough and cold or COVID On 14th January 11 a.m. हम मिलते हैं. Do take care of yourselves till then, and we are going to give you some important tips. आज के विनर्स का नाम अनाउंस करने वाली हूँ. किशोर माली, अनिकेत अरकड़ी, अमरेश कुमार. I repeat your names: Kishore Mali, Aniket Arkadi, Amresh Kumar. You have to write back to us at marketing@apollo247.com and claim your prizes. You have to give us the number which is associated with Apollo 24/7, and you do receive your gift vouchers there. Thank you all for joining us on this Sunday morning of the first Sunday of our new year. Take care of your health. Take charge of your fitness. Namaskar.